This is the dynamic that has been created in those red states by Republican governors and Republican legislatures that have refused to expand Medicaid. And then the question becomes, will there be enough activism and organization in these states to make these people realize that this is a function of their state and not Obamacare? Now, I'm in no way endorsing this model, other, I guess, than beyond the status quo. And I think there's a tactical argument to be made that without any reform, there would be more pressure to move towards something more like a single payer. I think that there's probably a stronger argument that the examples that may be set in neighboring states might provide more leverage in terms of providing better healthcare reform down the road. I mean, we're obviously years away from this, but I'm quite convinced that things like the Berlin Wall fell because too many people were getting access to Western things like toilet paper and David Bowie concerts. So it remains to be seen, but understand that's going to be the dynamic come this fall. If you are lucky enough to live in a state like California that has been aggressive with these exchanges, you may find that you have an opportunity to get some form of decent health care coverage. And remember, the best parts of health insurance reform has to do with the regulations that say no rescission, no lifetime caps, no pre-existing conditions. I mean, the thing that is the hardest aspect of healthcare reform is that 80% of the costs of healthcare are borne by 20% of the population. You just never know if you're going to be one in 5 or 4 that is going to need your healthcare insurance to work the way that it's supposed to. You just never get to that point where you realize how decimating it can be when you are afflicted with a disease or you're hit by a bus, and after a couple of weeks in the hospital, your health insurance company says, you've busted through your lifetime cap. You're on your own. We will not see this happening anymore. We have begun to see a flattening of the growth rate in health insurance costs, or I should say health care costs. We're not 100% sure why this has happened. Some people speculate that it's a function of the recession, but we're also seeing this in Medicare, which theoretically should be immune from the broader economy. I happen to think it's a lot of drugs have come off patent. And so we're seeing drug costs drop. But we don't know. So this is a good sign. And, it's something to keep an eye on as we get closer, because this is going to become really big in our politics, I think, into 2014, if you can believe it. As disturbing as this will be, to have to relitigate this stuff.